Hello, everybody. Dr. Alfred Marquez. Um, let's start off the topic, and what I'm going to be speaking about is pregnancy, and I'm going to give you some tips um, in how to approach and things that you can do to really help your pregnancy along, not just from a dental standpoint. By the way, let me tell you a little bit about myself. Dr. Alfred Marquez at Marquez Integrative uh, Dental, and we have been known to listen to our patients, take care of our patients, meet their needs. Um, we pride ourselves in taking time to make sure that our patients' needs are met. Our driver is patient comfort. The office and the staff, I've got a wonderful staff, and they do just really an excellent job. That's just a little bit about me. For now, I'm going to ask you, would you mind putting your name and tell me where in the city you're located in the comments section, just to know who's out there. And by the way, I'm going to have 3 giveaways after this next week, with everybody going into the pool that gives us comments. And if you want to increase your odds of winning, all you have to do is share us, like us, all that cool stuff. But anyway, let's go ahead and just jump on in here. First of all, if you're watching this, most likely you're pregnant, or somebody that is pregnant. Everybody knows this. Someone that is pregnant or not, and it's a beautiful experience. I think about it, and I think this is such a miraculous process whereby you start off with 1 cell, and 9 months later you get this 7-pound creation called an infant that is so perfect. And what I'm trying to do is, what are things that we can do that will help you along and make your pregnancy better, from not just a dental standpoint, but also a medical standpoint, a whole body approach. So let me tell you about the giveaway I'm going to have at the end. These are actually 2 books. I think they're must-reads for anybody that is pregnant. One is Baby-Led Weaning. I apologize, this is backwards. Get in front of a mirror and look at it. But that's Baby-Led Weaning. This is one of the books. The second book, I think, is really an incredible book by Dr. Paul Thomas. It's called The Vaccine Friendly Plan. And I believe that this is really a must-read. It's a really practical guide for parents of new infants. So, like I said, we're going to give 3 sets away, and this will be from a drawing next week. So let's jump in. First of all, the first thing I'd like to say, pregnancy is not a disease. Of course not. It's not a disease. It's just a very unique time in your life when perfect health on your part is going to affect you and is going to affect the new baby growing inside of you. So you want everything as perfect as you possibly can. And of course, who doesn't want a perfectly healthy baby? Now, like I said, my topics that I'm going to be discussing are both dental and non-dental. So let's start first with, what is good oral health? And why is good oral health so important? I mean, what's a big deal? What good oral health? I'm over here. I have a baby in my abdomen. My mouth is up here. What's a big deal? Well, it is a big deal. It's a very big deal. In fact, we know that oral health affects so many different things. It affects our heart. It affects diabetes. It affects Alzheimer's and dementia. So definitely it plays into our bodily functions, and certainly this is a factor in pregnancy. If you have unhealthy gums, you stand a much greater risk of having a preterm baby. You also have a much greater risk of having a low birth weight baby, which really isn't a good thing for the baby. Interesting, but it ties into oral health. So both you and your baby are affected by all the things that happen to you. So we're going to start off first. I'm going to talk about boring stuff, oral health, oral hygiene. What's a big deal with oral hygiene? Well, oral hygiene, you're trying to control bacteria. That's what it comes down to. Controlling bacteria that's in your mouth. Now, over the years, we've been, how can I say it, brainwashed to believe that all bacteria is bad. Bacteria is terrible. We see commercials on TV that, throw these mouthwashes and kill all the germs because all germs are bad. But the reality of that is there's good bugs and there's bad bugs. And in fact, we're composed from the outside, the inside of trillions of bacteria that are very synergistic in the way they live with us and function with our body. In fact, if we were born into a place where there's absolutely no bacteria, we wouldn't last very long. We're very codependent on bacteria. But what we try to do is coax our body and coax a proliferation of healthy bacteria. And that's the reason we brush. That's the reason we floss, is we're trying to control that bacteria. And we'll go into that just a little bit more. Rule of thumb, brush 2 times a day. Use a soft toothbrush. Make sure you get your brush against the gums when you brush. And you should not notice any bleeding at all. If you do, that should be a sign to you that you need to brush a little bit more and be a little bit more thorough. If the bleeding continues, you need to see your dentist. So 2 times a day is usually adequate. And take your time, make sure you get all surfaces of the teeth. The other thing is, of course, flossing. Flossing is important, and people don't like to floss, probably because it takes a long time. Supposedly, I can floss my mouth probably in less than 30 seconds, and I think really once you get the hang of it, you can do the same. But flossing is good. Find a time for you to floss. I tell my patients all the time, don't lock yourself up in the bathroom and try and floss, or do it at the end of the day, but rather pick a time that you're busy doing something else. In my case, what I do is I actually use floss picks, which are good, and I'll use them when I'm driving to work. I'll come to a red light, I'll go ahead and floss, and that way I'm not bored in the restroom trying to do it. Another thing that works out very nicely are those little rubber picks that you can use interproximally between your teeth. And you just clean, and you're thinking of clean. You're not jamming it into your gums. You're just leaning very lightly against the tooth and cleaning the front tooth and cleaning the back tooth. But flossing should occur once a day at least. So that's all you have to do, pregnant or not. That's good advice. Okay, another thing we see in pregnant women that they struggle with is increased gag reflex. They get the toothbrush in there and they just gag so easily. What can you do to control that? One of the things you can do is relax, breathe through your nose, and approach brushing very slowly, very deliberately, and try to distract yourself, focusing on your breathing and relaxing, and making sure also you're breathing through your nose. So that's one strategy that for a lot of people works. You can also rinse your mouth with ice water. That'll help lessen the sensation and the onset of gagging. So that's another option. You can, crazy as it sounds, stomp your feet. While you're brushing, stomp your feet. This distracts you from the actual sensation and is pretty beneficial. So those are some techniques to help you with the gagging and how to control it. Another thing that's very common, kind of a real pain during the first trimester, many women will suffer from morning sickness, and that's no fun. But when we vomit, we will get a lot of acid in our stomach, and we're tempted to go in and start brushing our teeth. But really, that's not the way you should do it. Actually, what should happen after a vomiting episode, rinse your mouth really well with water. Just plain water is okay. You could also do a cup of water with a teaspoon of baking soda, and you put that in your mouth. And what you're trying to do is you're trying to neutralize the acid that's on your teeth, because when the acid's on your teeth, it's going to harm the enamel, and you don't want that to cause any issues. And that's the reason your first strategy after a vomiting episode is to neutralize the acid. If I go in immediately and start brushing my teeth, there's going to be soft enamel, and I can actually abrade it much more easily after it's been exposed to acid. So if you neutralize the acid, whether it's by rinsing or using baking soda, wait at least 30 minutes before you brush your teeth. Now, why do you do that? Well, because our saliva will begin to remineralize the teeth. It does so very quickly, and you are less likely to damage your teeth when you go in and brush them. So that's just a word of advice there. Am I going to get more tooth decay? I heard that for every baby I have, this is women that have told me, I'm likely going to lose a tooth. That's an old wives' tale. That's not really true. You may become more susceptible to tooth decay, but it's not directly related to your pregnancy. It'll be related to lifestyle changes, perhaps the vomiting. That can be a factor. Maybe more frequent eating. There's a lot more snacking, perhaps. There might be cravings, and people overdoing it with high carbs or sweets. So that can come into play. Now, what does more frequent eating have to do with it? Well, every time we eat, every time we get anything in our mouth, bacteria will start to break it down, and our mouth actually becomes a little more acidic, which then can predispose us to tooth decay. So frequent eating can cause that. And of course, we know about candy, we know about sweets. My recommendation is, during pregnancy, stay away from sweets as much as you can. Stay away from sweets. It's not good for you. It's not good for the baby. So really, getting more tooth decay does not have to be an issue. Bleeding gums is something that a lot of women will start to notice, okay? And that's partially due to hormonal changes that occur and subsequent inflammation and reaction to bacteria that accumulates in your mouth will occur in a lot of individuals. So the key to this is great oral hygiene practices. Do that. Control your oral hygiene. Control the bacteria, because you absolutely want to control the bacteria. You don't want your gums getting swollen, and you don't want to develop a more serious issue, a more serious problem, because more serious problems, like I said, can affect the baby directly. Again, low birth weight or preterm babies can can occur because of that. There's something else also known as pregnancy tumors, which we see in women, not all that frequently, but we do see it. Pregnancy tumor is a red lesion that might occur in between the teeth, and the gum tissue gets kind of puffy and a little reddish ball. That really, for the most part, is related to oral hygiene, and the pregnancy tumor might come out. Usually they'll resolve themselves after pregnancy, and if not, sometimes they have to be removed, but they're removed very easily. So that is something that you might see, and you don't see it all the time. So during this critical time, pregnancy, there's 3 pillars of health that you need to focus on, just like when you're not pregnant. One is sleep, nutrition, and exercise. Get those 3 things in check, and you're going to be so much better, and so will your baby. So as far as exercise is concerned, you should go out walking, do exercise. You're not sick, you're just pregnant. And there's classes that you can take, different places that you can find out about and exercise, but that'll be beneficial for you and beneficial for the baby. You need to get great nutrition, okay? Lots of vegetables, lots of fruits, lots of whole foods, lots of good protein. Get folic acid. Folic acid is great at preventing certain types of birth defects, and your medical doctor will talk to you about that. But good balanced diets. Avoid processed foods. Get good nutritional food, and you can find out a lot about that. Your drink of choice should be water. Water, just plain water. Water is the best thing you can drink. A lot of people say, well, I'm going to do a lot of juice because it's fruit juice, it's good for you. Well, unfortunately, a lot of the juices that we get are so enriched with corn syrup or high fructose corn syrup, and that's not good for you. That's not good for the baby either. So just get used to drinking water. You can change the flavor of water if you ice it down. You can get maybe water, get a water jug and put slices of lemon or slices of orange in it to flavor it a little bit. That's nothing wrong with that. I like cucumber water. Just leave a cucumber in water, and it's just really a nice flavor. But stay away from the sodas. Stay away from the juice. That'll be really beneficial for you. Another thing that will really benefit you a lot are probiotics. Talk to your doctor about that, or do your own research. Probiotics. So what are probiotics? I mentioned earlier that our body is covered with trillions of bacteria. We have bacteria both internally, which is a big part of our immune system, externally, and there's good bacteria. You have a very unique fingerprint of this biome that lives in you and on you. Very unique. And when baby is born, the biome is actually going to be transferred to your baby. So you want good, healthy bacteria. Good, healthy bacteria, again, being transferred to the baby. And that's why vaginal birth is probably better than C-section, probably because of that fact. I think you'll find that a lot of doctors, a lot of research indicates that that's the case. I mean, there's a big difference in the health of a baby that goes through natural birth mechanism. Probably has a lot to do with the bacteria that's transferred. So Uh, Another question sometimes I hear, and this is for me a no-brainer. Uh, how much alcohol can I consume safely? Well, really, I don't think that's something you should even consider. I don't think alcohol uh, during the time of pregnancy is not a good thing. And the same holds true with smoking. There's no such thing as, well, I can just have a cigarette and I'll be okay. Um, why chance it? Watch out for secondhand smoke also. That's definitely not a good thing. Let's get into the next thing. The next topic is going to be um, dental visits. What about dental visits? Okay, rule of thumb. Dental visits will occur and should be continuous. Don't let that get behind you. As a rule of thumb, the first trimester, you only do emergency necessary treatment. That's a rule of thumb, and discuss that with your dentist. Discuss that with your medical doctor. But I think most people will concur that you absolutely can't put off emergency treatment because that can be harmful to you and that can be harmful to baby. But routine dental treatment, well, you're going to wait for the second and third trimesters. Keep that in mind. Visit your dentist. You're probably going to have to go more frequently as well to control that inflammation of the gums. Okay, so let's talk about sleep. Sleep. You need sleep. We all need sleep. A pregnant woman especially needs sleep. And that being said, very often sleep is a big problem for pregnant women, especially during the third trimester. They wake up a lot, they're uncomfortable, but one of the things that is extremely common is that you will notice that the female will start to snore. You know, she didn't used to snore, but now with the added weight, the added size in her belly, she will snore. And she starts waking up, and that can be an indicator that she's not breathing as well during the night. There's some obstruction. Well, we can actually help you construct appliances that will take snoring away and help you. And many women, that'll result in better sleep, significantly better. So if that's an issue, check with your dentist, but absolutely get your sleep. Okay, so baby is born. Okay, baby is born. And probably during pregnancy is a time that you have to make a decision. What am I going to do? How am I going to provide nutrition to my baby? Should I breastfeed? Should I bottle feed? Well, depending on who you talk to, some people will say, well, it's the exact same thing. I really don't think so. Breastfeeding is very unique. Breastfeeding creates a formula that was designed by God. And I mean, I don't care what we come up with, different formulas and whatnot, it is never going to be as good and nutritious as breast milk is for a baby. I would truly consider it. And what I would recommend is that before a baby comes, that you consult with lactation consultants, talk to them about the benefits of breastfeeding, talk to them about the things you look for when a baby is breastfeeding. How is it easier? How come sometimes it's difficult? One of the things that is extremely common is that it's difficult to breastfeed. There'll be different things that you might see where a baby becomes colicky, where the baby can't latch well, where the baby gets tired. This is very frequently related to the tongue and tongue ties that babies develop, and it's something that we see more commonly today than we used to. Back in the day, the nursing mother, I'm sorry, the birth maids that would help bring babies into the world would grab the baby, hand baby over to mom. The baby would then try to latch, and if the baby didn't latch or had difficulty, they would get the baby, and then she had a sharp fingernail and she would sever the frenulum, hand baby back to mom, and then breastfeeding was perfect. Well, today we don't do that. We don't use fingernails, but there are definitely things that can be done, and when it's indicated, and it can make a big difference. So what's the difference between bottle feeding and breastfeeding besides the contents of the milk? Well, when you breastfeed, there's more of a peristaltic, a wave motion of the tongue. And it's that wave motion of the tongue that pushes up on the pellet and expands it, pushes up and expands it, pushes up and expands it. So it affects the growth and development of the baby's face. That's called suckling. Now, when you're on a bottle, it's much different. There's a sucking motion, sucking whereby your face compresses and it constricts the jaw. You don't get as much expansion of the jaw as you would with breastfeeding. So that's just a tremendous benefit for baby. Speak to your physician, speak to your lactation consultant, see what they recommend for breastfeeding, and what you should look for, and for how long. Do I do it for 1 year, 2 years? It's so totally up to you, and there's benefits to the more time that a child is breastfed. But this is something that you should probably explore early on. So I think that, again, pregnancy is a wonderful time in your life. And there's so much to think of. It's a lot of preparation. Once again, put your name, contact in the comments, whether you're watching a recording or you're live. Put your name down, tell us where you're from, and automatically you'll be entered to get both of these books. And like I said, I'm going to give 3 sets away. Excellent books. If you don't win and get these books, I really recommend that you get these books and start reading them. I think they'll be very beneficial to you. So I wish you success. I wish you the very best with your new baby to come. God bless you. God bless your baby. And God bless your family. And I thank you very much. And one other thing. It looks like every Friday we're going to have a Fun Fact Friday. We're going to have different discussions about different topics. So be on the lookout, and be sure to share this. If there's someone you know that might benefit from this information, share with them. Share with them. Maybe you can change someone's life. And that's what it's all about. So here's to a beautiful baby, and have a wonderful and blessed weekend. And thank you.